All right, let's dive in. Today, we're going to be talking about understanding gynecological health, from those really common infections all the way to some critical conditions that you absolutely need to be aware of. Okay, so let's be real. Haven't we all had that moment, that little voice in your head asking, wait a second, is this feeling normal? You know what I'm talking about. And honestly, knowing your body's signals, learning to listen to them, that is your greatest strength. It's the key to everything. So where do we start? Well, before we can even talk about what goes wrong, we have to get a handle on what right even looks like, because your body has this amazing built-in system of natural defenses that works around the clock to keep things in balance. And the heart of that defense system, it's all about creating a healthy vaginal environment. Now, environment sounds kind of technical, but think of it like a perfectly balanced little ecosystem. It's full of beneficial or good bacteria, and their main job is to maintain a naturally acidic pH level, somewhere between 3.8 and 4.5. This acidity is like a superhero's force field. It's what protects you and makes it a really, really tough place for any harmful germs to set up shop. But here's the thing. That balance is delicate. It's a finely tuned system. And when something comes along and disturbs it, throws it out of whack, that protective shield we just talked about gets weakened. It's kind of like the security system goes down, opening the door for all sorts of infections to sneak in. This is ground zero for so many common issues. Okay, so let's get into it. What are those signs of disruption? When that balance gets upset, what exactly are we supposed to be looking for? Well, the general medical term you'll hear for this is vaginitis. But don't let the word scare you. It's basically just an umbrella term for inflammation of the vagina. And what causes it? It can be a few different things, but almost every time you can trace it right back to that balanced ecosystem getting knocked off course. All right, this is a big one. How in the world do you tell the difference between the two most common culprits? Let's break it down. First up, you've got bacterial vaginosis, or BV. The telltale signs here are a discharge that's usually thin and kind of gray or white. But the biggest giveaway? A strong, fishy odor. That's usually the main symptom people notice. Now, on the flip side, we have the classic yeast infection. Here, you're looking at a thick, white discharge that people often say looks like cottage cheese. But the main event with a yeast infection is usually not the smell. In fact, it's often odorless. The number one complaint is intense itching and burning. So see, very different clues. So you might be wondering, what's actually causing this imbalance? What are the triggers? Well, there are a bunch of common ones. Antibiotics are a biggie. They're great at killing bad bacteria, but they don't discriminate. They can wipe out your good bacteria too, leaving the door wide open. Then there's douching or using those heavily scented soaps and products. They might seem like a good idea for hygiene, but they can totally wreck that natural acidic pH we talked about. Hormonal changes are another factor. You know, the ups and downs during your menstrual cycle or during pregnancy. Even things like having a new sexual partner or just having a weakened immune system can be enough to tip the scales. Okay, now we need to shift gears a little bit because this is really important. We've talked about what happens when the balance is off. But what happens if some of these infections just go untreated? The problem doesn't always just stay put. It can travel, and it can escalate into something way, way more serious. And that brings us to something called pelvic inflammatory disease, or PID. The key thing to understand about PID is that it isn't just an infection in the vagina. It's what happens when that infection travels upward, past the cervix and into the upper reproductive organs. We're talking about the uterus, the fallopian tubes, and the ovaries. This is a huge leap in severity. It's a serious infection in a much more vulnerable area. So how does an infection make that journey? Well, the most common route by far is from untreated sexually transmitted infections, specifically things like chlamydia or gonorrhea. When those infections aren't treated, the bacteria don't just hang out. They can actually travel or ascend up into the reproductive tract, causing major inflammation and, unfortunately, some serious damage along the way. And this right here is why we have to talk about it. This is why it's so critical. Just take a second to really let this sink in. PID is the most common preventable cause of infertility in women. Think about that. A leading cause of infertility that we can often prevent. That word preventable, that's the one that should really stand out. It means we have the power to stop this from happening. Because the complications from PID are no joke. They are severe and they can be lifelong. The inflammation can cause scarring in the fallopian tubes. If those tubes get blocked, it can make it impossible for an egg to travel, leading to infertility. Or it could cause an ectopic pregnancy, where a pregnancy starts outside the womb, which is a life-threatening emergency. On top of that, it can lead to chronic, constant pelvic pain, and even abscesses, which are these nasty collections of pus inside the reproductive tract. It's just really devastating stuff. Okay, let's pivot for a moment, because not every serious threat works by spreading upward. There's another danger out there. It's much rarer, but it's incredibly sudden and serious. This happens when toxins from bacteria get directly into your bloodstream. It's a bit of a hidden threat, which is why knowing the warning signs is so important. We're talking about toxic shock syndrome, or TSS. So what is it exactly? Well, it's a rare but life-threatening condition. It happens when certain types of very common bacteria, like staph or strep, which a lot of us carry on our skin, get a chance to grow out of control and start pumping out these really potent toxins. If those toxins make their way into your bloodstream, they trigger a massive inflammatory response that can overwhelm your whole body and lead to severe organ damage or failure. Now, if there is one thing you remember about TSS, let it be this. The symptoms hit you like a ton of bricks. They are sudden, and they get worse fast. We're not talking about feeling a little off for a few days. We're talking about a sudden, out-of-nowhere, high fever and chills, a rash that looks like a bad sunburn, nausea, vomiting, diarrhea, and then the really scary stuff, dizziness, fainting, a sudden drop in blood pressure. This isn't a wait-and-see situation. This is an absolute medical emergency. And here's something that surprises a lot of people. For decades, TSS has been almost exclusively linked with tampon use in the public mind. And while that is a risk factor, it's only about half the story. Roughly half of all TSS cases have absolutely nothing to do with menstruation. They can be caused by bacteria getting into skin wounds, burns, cuts, or even surgical sites. So the real risk isn't just one product. It's any situation that creates the perfect storm for these specific bacteria to grow and release their toxins. And if you're still not convinced of the urgency, look at this number. When TSS isn't treated immediately, the mortality rate can be anywhere from 30% all the way up to a staggering 70%. That's just terrifying. This makes it crystal clear that this is not something you can just ride out. It is a literal race against time, and every single second counts. Okay, so we've talked about some pretty heavy stuff, but now we get to the most important part of this whole conversation, the empowering part. How do you take control? How do you protect yourself? Let's talk about the simple, actionable things you can do. And the best news is, these steps are pretty straightforward, but they are incredibly effective. So, number 1, practice good hygiene, but do it smartly. That means just washing the external area with warm water. You've got to avoid the douching and all those scented products that mess with your natural pH. Number 2, wear breathable clothing. Cotton underwear is your best friend, and try not to hang around in wet clothes like a bathing suit for too long. Number 3, use menstrual products safely. That means changing tampons every 4 to 8 hours and always using the lowest absorbency that you actually need. And finally, number 4, which is a big one, practice safe sex. Using condoms is one of the most effective ways to prevent the STIs that can lead to PID. And please remember this. The good news in all of this is that treatments are available. We have really effective antibiotics and antifungal medications that can clear these infections up. But, and this is a huge but, the medicine only works if it's the right medicine for the right problem. You can't fight what you haven't identified, and that's why getting a proper diagnosis from a doctor is the single most important first step you can take. Trying to guess and self-treat can waste time, not work, or even make things worse. And speaking of treatment, there's one more piece of the puzzle that is absolutely non-negotiable. If you're treated for a sexually transmitted infection, your recent sexual partners have to get tested and treated too. It's not just about you. If they aren't treated, you can get reinfected almost immediately. You end up just passing the infection back and forth in a cycle, which keeps both of you at risk for all those serious complications like PID we talked about. So, when you boil it all down, it really comes back to where we started. Your health is in your hands. Your body is constantly communicating with you, sending you signals. The real power comes from learning to listen, knowing what's normal for you, recognizing the moment something feels off, and having the courage to take action. So the final question is really simple. Are you listening to what your body is trying to tell you?